Good evening, all. Welcome to CBME Anatomy session on planning of integrated session. Today we have Dr. Angela Viswasam, Professor of Anatomy, Travancore Medical College, Kollam, Kerala. She will be taking us through the different aspects of how we can plan integrated sessions. If anybody is having any questions, you can just write into the chat box, or you can write in your WhatsApp group. So it will be replied at the end of session. Over to you, ma'am.
Thank you, sir. Am I audible? Good evening.
Yes, ma'am. Yes, ma'am. Yeah.
Good evening. I thank the organizers of MEU India for having given me this opportunity to present a planning of integration sessions in this program called a CBME Anatomy. Dr. Sanjay Bedi has been a forerunner in running programs which help all people come forward and learn about newer aspects of medical education. So now, where do we stand with integration sessions? The most important thing is that there is a lot of knowledge available. This explosion of knowledge and the lack of connectedness has made MCI think about newer techniques. And they have come up with the Graduate Medical Education Regulation of 2019, which will help us see further forward to identify a basic doctor who will meet all relevant global needs. So this is our IMG. To get to reach this IMG, we need to plan. And as a first step of planning, we need to learn about a few things. So first and foremost, we start with the integration module here. I believe most of us are familiar with the integration module, but for those who haven't been through the module, I have put up the link here. So you could just put up the link in your systems and go through and follow with the link along. Now, in the integration module, which is module 4 of the MCI, the objective is quite large. The participant must be able to facilitate the development of an aligned and integrated curriculum in his or her institution, as envisaged in the GMER document. So that looks almost like competency to me. So I thought I would break it up into smaller objectives. Now, at the end of this session, what should the learner be able to do? First and foremost, we should be able to define the terms alignment and integration. In the PowerPoint, which had been provided as pre-reading, we had gone through the steps of Harden and understood that Harden had taken us through 11 steps as we ascended up from the ladder. This pertains to the term spices, which we think is a paradigm shift in medical education. The term I in spices is for integration. We want to shift from the traditional discipline-based education or subject-based education to an integrated education. Many people have spoken about integration, but we need to keep ourselves in terms with integration as pertaining to GMER. So our second objective to be would be to understand the terms alignment and integration as pertaining to GMER. First, understanding it broadly, and then as pertaining to GMER. The next objective, so once we understand the terms alignment and integration, we need to go into preparation of our timetable. So we identify the steps in creating an aligned timetable and integration topic. Once we learn about the steps, we need to go in depth into the steps if we want to do it properly. So we have got to go, it's a higher order thinking skills. We need to comprehend the stepwise process in developing and implementing the integrated topics across all three phases. These are the objectives of my session. So now, if you look at this picture, does it make any sense to you? You have lots of information there, but there seems to be some disconnectedness. Nothing makes sense. It's a jigsaw puzzle which has not been arranged. But you know, it's there. The picture lies deep within it. Now I take a minute, I think about it, and I start arranging it. Here, low, you see the picture of a beautiful fish coming up. So that is what basically alignment and integration would correspond to. You would want to put things together such that to see it from a better perspective. So now we go into our first objective, which is to define the terms alignment and integration. MCI in its modules and in its training documents has put up this definition for alignment, wherein which it is teaching of a subject material that occurs under a particular organ system or disease. And here, this disease concept or the organ system concept is taken from the same phase in the same time frame. So we arrange it temporarily, and this is what is called as alignment. Compare this to integration. So when you think about integration, the concepts in a topic or organ system, just as we said before, are that are similar or overlapping are now merged into a single teaching session. Here, the subject-based demarcations are removed. So that is one of the most important points or differences between alignment and integration. In alignment, we maintain the subject demarcation. So we just go on to present it in the same time frame temporarily, while in integration, the subject demarcations are removed. So this is what is the basic difference between alignment and integration. Now, MCI has come up with a definition for integration. Integration is a learning experience that allows the learner to, first and foremost, perceive relationships from the blocks of knowledge provided, and also to develop a unified view of its basis and application. KG Sheshadri sir has put this up in the document here, so I've adapted it from that document. So that is what is about integration. Now, do we really need to integrate? So that is a big $1,000,000 question. Do we really need to integrate at any point? So just think about our curriculum. Our curriculum first exposes the students to dead human beings in anatomy, frogs or other animals in physiology, and very later into human beings. And this is considered as an unsatisfactory career in medicine. We need a holistic view of the patient's problem, and that is why we need to integrate. So once we think about integration, quite many definitions have been put forward about integration by Dressler, Shoemaker, but what struck me most was Humphreys. So Humphreys said it basically in this manner. It is taken for granted, apparently, that in time, students will see for themselves how things fit together. Unfortunately, the reality of the situation is that they tend to learn what we teach and only what we teach. If we teach connectedness and integration, they learn that. If we teach separation and discontinuity, that is what they learn. To suppose otherwise would be incongruous. Right now, I think that is what we've been doing. We've been giving them a lot of blocks and we expect them to bring it together. So in the second part of our class, I would like to take you to the relevant extracts of GMER. So we've been through the relevant extracts of GMER in our previous classes also. The first part of GMER actually focuses upon learning, which is competency based, integrated, and student centered, and focuses on the acquisition of skills, ethical, and humanistic values. So that is the crux of the first preamble. Now, if you look at the second paragraph, it speaks about didactic learning, which is the most teacher-centric method of teaching learning method, as to be restricted to less than 1/3 of the total time. And they want to give more emphasis on student-centric methods. As you see, it's a progress towards self-directed learning. We want to encourage students to take active part. So this basically deals with the shift of focus from teaching learning methods from teacher-centric to learner-centric. The last paragraph talks about integration in terms of horizontal and vertical. So if we've got to understand what integration is, we need to understand what the present learning methodology was. That is the traditional teaching method. So here I have put up a table where I see that in the month of January, anatomy people talk about the structure of heart. Physiology may be about the GIT. And it is only in March, quite after the structure of the heart has been taught, that serious physiology comes into play. And sometime later, biochemistry people talk about it. So creatinine, kinase, and troponin. So these are things which should have been come together. So in traditional teaching or discipline-based teaching, teaching is in silos. Basic subjects will form the foundation upon which other subjects are built. So it's actually like the kids building block principle. Each building block is an integral part, and each building block is a subject which has its own block of time and is restricted to one part of the course. It's left to the student as a whole to make an idea of what it is. So jigsaw puzzle is never filled for them. Now, if you look at the next stage of integration, which is horizontal integration, where we want to do with disciplines which are parallel disciplines in the same phase. So here I've taken up again anatomy, physiology, and biochemistry because we are all anatomists and we deal with phase one. Now, in one period, so just put it up as January first week, when the cardiology, when the structure of the heart is spoken about in anatomy, in the thorax dissection, we go about serious physiology and also correlate it with the biochemistry markers which are present there. This is called as horizontal integration. Why do we need horizontal integration? So actually, this gives interconnectedness to the students between the three subjects. And if there is anything like in the anatomy of the heart, as we talk about blood supply, we reach the essay note, and then we do not know whether we need to go into detail about the conducting system of the heart or not. So if we think about an aligning with physiology, physiology people would tell us, okay, we are talking more about the conducting system. So likewise, we provide interconnectedness and redundancy is also avoided. The next step of integration which we have here is vertical integration. Vertical integration is integration between disciplines traditionally taught in different phases of the curriculum. In the earlier phases, so that is when you're teaching anatomy, physiology, or biochemistry, the emphasis would be on the applicated uses of the basic science concept taught. So we all know when we take a class on the heart, the blood supply of the heart, our set induction is usually a case-based learning, which we put there about a widowmaker's artery, which will get the student intrigued to learn more. So here we emphasize on the applicative use of the basic science concept taught. Now, if you look at it in phase 3, ischemic heart disease as taught in medicine, they would utilize the previous phases to build on prior knowledge and emphasize on the foundations of clinical practice. So this is what is called as vertical integration. So now we know that MCA wants us to integrate. To what level do they want us to integrate? So integration as it relates to GMER is dependent on temporal coordination, the terms temporal coordination, sharing, correlation, and nesting, which we will be discussing as we progress. So now, why don't they want us to go into the higher levels, which is transdisciplinary, multidisciplinary, or interdisciplinary? Why do they want to restrict us? This should be given some thought. Subject-based education has tremendous advantages. It actually provides the learner with the opportunity to dwell deep into the learning matter and helps the learner acquire strong fundamental concepts and the ability to build on it and attain scholarship at a higher level. But even when this is so important, the unique needs of medical education necessitate the understanding of interconnectedness between subjects and their ultimate application to the patient. So now we know we need to have subject-based teaching. We also need to have interconnectedness and need to focus it upon the application of the patient. Thus, to enhance wholesomeness of education in CBME while retaining the strength and flavor of subject-based instructions, MCI has recommended for these two strategies. The two strategies here are alignment and integration. So we come across these two terms which are called as alignment and integration. What does MCI mean by the term alignment? Alignment actually corresponds to Hardin's temporal coordination, where similar topics in different subjects are to be learned separately but during the same time frame. So this is called as alignment. So when we teach the liver in anatomy, we expect bilirubin metabolism or jaundice to be taught in physiology and biochemistry. So this concept is called as alignment and gives better understanding to the student. Now, we go on to the next step from alignment. So here we know in alignment, it is subject-based teaching. We just coordinate with the department such that there is a temporal alignment, or all subjects are coordinated temporarily. We go on to the next phase, which is called as integration. So here I have put an example for alignment. Now, if you look at this example for alignment, we can see that I've put up two timetables. In the upper part, it shows that the one in green here is the cardiovascular system. The cardiovascular system is aligned between anatomy, physiology, and biochemistry. While you can see two regions which have been put as outline boxes, which is in red, anatomy and radiology has been put as an outline box. So what is this session? This session is basically nesting. So I would simply tell you, while teaching cardiovascular system, we always speak about the radiograph and we speak about the cardiothoracic ratio and the significance of the cardiothoracic ratio to identify cardiomegaly or to identify the borders of the heart. So this applied anatomy which comes into the subject teaching is what we call here as a nested session. While in physiology and biochemistry, they come across common regions which they can remove away. So that is called as a shared session. We'll be discussing more of sharing and nesting as we progress. Now, if you look at the second example, which here is the respiratory system, you can see that in nested sessions, it is usually with higher phases. Physiology with medicine, physiology with microbiology, physiology with pharmacology. So what do we mean by this nested session? As we teach physiology, they would speak a little about the medical aspects or the pathophysiology of the disease, or what are the drugs which can be given here, the adrenergic drugs, the noradrenergic drugs, what are the drugs which cause bronchospasm. So this mention here is what is called as the nested session. We would understand nesting and alignment as we progress a little more. Nesting comes into this term. So alignment is where we have a temporal coordination, putting it in the same time frame. Now, if you look here, you can see you go for the next concept, which is integration. Now, MCI speaks both about alignment and integration. How much can we integrate? Right now, as a starting, they have told us let's integrate only about 20% of the curriculum. We need not go beyond it because we need to know what integration is before we go on to lose the flavor of the subjects. So the first step of integration is called as nesting. Nesting is a terminology new to us, but it's a concept which is quite familiar to every anatomist here. What do we do in nesting? So simple example, whenever we speak about the anatomical snuff box, don't we always mention fracture of the scaphoid? So that is, here it is a subject-based teaching. We're talking about the anatomical snuff box, but the anatomy teacher targets an objective from a different subject. It can be from the same phase or from another phase. So you target it from another phase, and this is called as nesting. An example here would be, while teaching structure of the heart, you relate it to the heart as a pump and its loss of function to cardiac failure. While teaching histology of the vascular system, you relate it to endothelial injury and thrombus formation. So all this is what we've been doing. You teach fracture clavicle along with clavicle. So all what applied aspect we say while we are teaching is what we call as nesting. So it is subject-based teaching and the teacher targets an objective from a different subject. Now we go on to the next step, which is called as sharing. So in sharing, also you have subject-based teaching. But the thing is that two departments or two different disciplines will sit together and they will come and form a planning program. They implement a teaching program and share some of their objectives. So this is called as sharing. So two disciplines may agree to plan and jointly implement a teaching program. Example is we teach about the histology of pancreas. So why not ask biochemistry people to speak about histology of pancreas when they talk about insulin metabolism, or we talk about insulin metabolism when we talk about the histology of pancreas. So this concept is what is called as sharing. So here some objectives are addressed together as a meaningful whole. So this is the next step of integration. The next step is what we are planning to do right now, and this is called as correlation. Here, the emphasis is on discipline-based subjects. So you have discipline-based subject courses taking most of the curricular time, while you use an integrated session in addition to this. So this integrated session is usually a case which helps you. So you want to teach coronary arteries. You put in a linker session which will help you understand the clinical application of the concepts while linking to the clinical program. So these are the steps which you would want to take. So if you look at it, alignment is temporal coordination, while integration, which should not exceed 20%, has been divided into nesting, which is your time-old application of anatomy, which you say in your class as clinical anatomy. Sharing is something which we should learn to do, where we have to plan programs together. Correlation is when you have an extraneous session, a teaching session, added in addition to the subject-based teaching. So now we go on to understand that these are the concepts of integration as related to GMER. So alignment and also integration. Now, what are the points which you should keep in mind as you think about it? Always ensure that phase-based objectives are given primacy. So you're thinking about teaching anatomy, don't lose your objective and go into lots of clinical anatomy. The students might find it more interesting. As you know, because during the last 1 year, we have learned it lots. We see the students find it so interesting to go to the hospital. But we should ensure that as we integrate, that our objectives are given primacy. The integrative elements from other phases should be used only to provide adequate recall and understand the clinical application of the concepts. And so all of us might be thinking, now if I start integrating, will I need more teachers in my class? Isn't that team teaching? You don't need more teachers in your class. All of us have been trained to do this as basic doctors. So you can use experts from other phases or from the same phase to plan the lesson, but you don't need to use them for delivering the lesson unless you deem it necessary. You think, okay, I'm not able to do this perfectly. Shall I bring in somebody? So that's only when you need to bring in a person from the other session. Integration does not mean bringing teachers from various subjects. It only means that the concept gets integrated. So the concept here gets integrated. And now as we plan integration, we always say, right, when you learned about objectives, Sheila madam had put on a golden triangle where she spoke about objectives, deriving the teaching learning methods, and being controlled by the assessment. So it is, if you look at a student will learn only what he is going to be assessed upon. Even here, that is one issue which we might face as we progress. assessment will continue to be subject-based. So you should ensure that the phase appropriate correlates are tested. Why do we need to test the others? That is, if you look at it, we need to go higher up in the domains of knowledge. To test the higher order thinking skills, you can put in few questions here and there to understand if the learner has internalized and integrated the concepts. So this is only to understand if they have internalized and integrated the concept that we think about testing a higher order thinking skills. And you should always keep in mind that in preclinical subjects, we need to test or integrate only 20% from the clinical sciences, and 80% will be hours and hours alone, where in which we can do alignment. So you think about alignment for up to 80% and integration up to 20%. So when they reach the clinical sciences or the phase 3, they would think about putting preclinical things as your 20%. So that would be the progress which we have here. Now, you want to do alignment integration. You go through all of this. Who is going to help you do this? Or who is responsible for alignment and integration in your institution? MCI speaks about alignment and integration. They are the highest level of curricular governance. So from the grassroots level, it is the dean of the institution who is responsible as chairperson of the curriculum committee for the overall development. So first and foremost, it's the dean. The dean is the chairperson of the curriculum committee. So the next important people here would be your curriculum committee. The curriculum committee will go on to form phase-wise committees and topic teams. The curriculum committee also decides, so do we want to do organ-based integration or system-based integration? It takes such decisions. It asks the phase-wise committee to go on, read the documents of the UG curriculum document, volume 1, 2, and 3. So for each phase, they will have to go through the competencies given there, break it up into objectives, identify the teaching learning method, and they will oversee the creation of an aligned integrated curriculum. Now the topic team, who forms the topic team? The topic team can be formed of people from each department wherein which we want to take in our competencies from each phase, and they are responsible for delivery of the topic team. The topic, the alignment integrated topic. So most of us here would be part of one of these teams, the curriculum committee, the phase-wise committee, or the topic team. Now, what would the topic team do? The topic team knows. So once we are part of the topic team, we know we have to prepare this timetable. So being part of this, what do we do next? So that is the most important part of this curriculum. So have you all done this at some point of time during the last 1 year? Sat together to prepare the timetable. So now as we sit together to prepare the timetable, you look for non-aligned topics in each subject. As much as you think, can you align your lower limb dissection with another topic in physiology? No, you need non-aligned topics. What can be aligned? Look for integrated sessions. Integrated sessions can be organ-based. So it can be thyroid, it can be jaundice, it can be ischemic heart disease. So you look for integrated sessions. What are the topics which can be given as self-directed learning? Self-directed learning is a newer topic which will be dealt with in detail later. Now, as you plan this, we always should have assessment in focus. And once we have assessment in focus, ensure that the integrity of the hours is maintained. What do I mean by integrity of total hours? Sheila Madam had said in her talk that 220 hours should be for lectures, which is 1/3 of the total hours. So of the 415 hours for small group discussion, what can be effectively implemented using small group discussions to UAP? So ensure the total integrity of the hours and start with it. So how will we start about it? We need to have a time framework to start with it. So this would act as a proper framework. So if you cannot align it, teach it separately. If you can be taught in different sessions in the same topic, align it. So that is hepatobiliary system in anatomy, align with physiology in bilirubin metabolism, and the lab investigations of jaundice and biochemistry. Now, the next question is, can they be taught in the same session, the same topic? I don't think I need different sessions. So if you can be taught, if it can be taught in the same session, the same topic, we can either share it or nest it. Sharing would be you need to plan it with the other department because you'll be encroaching onto their objectives. Nesting, the other department doesn't even have to know that we are going to take it up, like presenting the clinical features and radiographs of fracture clavicle during a small group discussion on clavicle. Now, can we use a concept to link all this together? So that becomes very, very important. So now we have a framework. We need to ask ourselves $1,000,000 question. So if you look at the steps in development of A2, the $1,000,000 question is, can the competency be acquired with similar competencies in other subjects? If your answer is no, fine. Ensure that these are allotted specific time and are running parallel to the aligned deadline. It is, we should not be thinking of how can we fit it here, how can we align it. No, there might be a lot of topics which we cannot align with another subject. Just like we have an embryology, general embryology, it would be difficult to align it with physiology and biochemistry. So all this can be given as non-aligned topics in our timetable. Now we ask the question once again: can the competency be acquired with similar competencies in other subjects? And you get an answer yes. Now what would you do? So you start rummaging around your UG curriculum document and identify the competencies. So you choose a strategy there. Now, if I can teach it with other competencies, should I teach it as an organ or should I teach it based on a disease? So you identify the first strategy, which is, do you want to go by organ or the disease based? Actually, as by the MCI curricular governance rules, it is the curriculum committee which should decide, and the phase-wise committee which should decide whether you want to go by organ system or disease based. Once you have decided on that, you go in and look for the competencies to be acquired there. So first, look for the same phase. So we remain in anatomy, physiology, and biochemistry. We look for competencies in the same phase. Now from each phase, you review the competency. So from each phase, you review the competency and thus reduce the redundancy. Redundancy is repetition of the competencies which we see. Now you have your first phase competencies together. Now you go in and look for competencies in the other phases which needs reinforcement or introduction. So if you look at competencies in the next phase which needs introduction, you think about these competencies. And now as you plan together, Sheila Madam was talking, competencies, you break it down into objectives, you bring in teaching learning methods, and you start creating learning sessions. Now for this learning session to be effective in an I2, we think about creating a linker. So what is a linker here? A linker basically is a case. It's simply a case-based learning. So you create a linker to integrate all these concepts together. And now that doesn't complete it. Your steps for development is complete only when you create a formative assessment for the same session. Now, what is the significance of the linker? The linker is actually a case. The linker lingers throughout the course. So in the first phase, the linker will focus more about anatomy, physiology, biochemistry. While if you go into the second phase, you can use the same case-based learning with the focus being shifted to histopathology. And the third phase, the same linker can be used for clinical diagnosis and management. Now, we know the steps of the development of an A2. So we've got to go into this comprehension of the nuances. So now we look at it as a timetable. How do we do integration? So in the first diagram, which is given here, this is phase 1, phase 2, and phase 3. What is shown in yellow here are topics which need to be taught together. First, earlier it was traditional, it is silo based, nobody knows what becomes important. So same core ideas are taught at different phases. In the second diagram, you can see here that in phase 1, the yellows are brought together, the greens are brought together. So that is, the topics are now aligned temporarily. So you've aligned them temporarily. So just think of it simply to be your hepatobiliary system in anatomy, the bilirubin metabolism in physiology, and biochemistry. Now, if you look at it, in the next thing, you can see, why can't I teach bilirubin metabolism in physiology and biochemistry together? Can't this concept be shared? If I sit with my physiology and biochemistry people together, I could put a lot of competencies together. A shared session can be created. So this is the first step towards integration, where you have a sharing. Now, in the next concept is a linker. So you want to teach them the same thing, jaundice. You have the hepatobiliary system. So you want to show them the same thing. You go to phase 3, you take a case. It's case-based learning. You have a case with a person coming with jaundice. You put in the lab diagnosis, you put in the clinical features, you give it back to them. And this will actually help them correlate it better. So this is the next phase where you have it. That is, there is increased correlation, which can be used with the linker. The linker is the one which you see with the purple box. So this is how we progress. Now, the next diagram here shows you quite a lot of squares. So if you look at it closely, you can see that when I'm teaching anatomy, I'm taking something from pathology. I'm teaching vascular system. I take a little bit of thrombus formation. So that is nesting. I'm teaching anatomy, anything like anatomical snap box. I take a little bit of fracture scaphoid. So whatever clinical anatomy we say in our class, a thyroid gland moves with deglutition. So we're taking it up from your surgery. So this is what is called as nesting. Nesting is our what we have been doing so far. It's just that we put it into a newer terminology. So now that we have been through these steps, I would like to take you through a topic, an example. So how do we go about identifying it? So the first step in creating an A2 would be to identify the topic. I'm going through my curriculum document. I see competencies of thyroid. I see many competencies. So I start asking myself my $1,000,000 question. What was the $1,000,000 question? Can these competencies be achieved together with similar competencies in other subjects? I get my answer as yes, because I see integration there. Now, once I get my answer as yes, I go on to identify. Should I think about thyroid diseases or should I think about an organ? So, okay, it's basics. I'll think about it as an organ. It will be difficult for them to understand thyroid diseases now because I don't go much into my functional aspects. So I identify the topic here, and my topic is an organ-based item, and this is my thyroid. So I've decided on my topic, which is the first thing which you should do in conjunction with your curriculum committee and your topic committee. So you identify your topic. What is the next step? I put in all competencies which I can identify from phase 1. I go into the curriculum, I look into the anatomy document, I identify all competencies from thyroid. I put it together. So I have taken this from the MCI document and put it here. So you can see I put all competencies of thyroid. As I go down, I can see some of it is surface marking, some is development. Okay, I'll try to do as much as I can. So I put it all together. And I do the same with physiology. I identify the competencies pertaining to thyroid. I see that it is horizontally integrated with biochemistry. I dig through my competency document once again, and I go on to identify the competencies in biochemistry. So now I put it together. And once I put all these competencies together, I take the relevant competencies of anatomy, physiology, and biochemistry. Now, As a continuation of step 2, I think of going into other phases. So let me see, can I introduce some of the concepts in this phase? So I go into the next phase and I dig through the next your volume 1 itself, and I come up with methodology and pharmacology. So I see the competencies of thyroid of pharmacology and pathology. I put it up together. So shall I introduce a little bit more from phase 3, or will it be too much? No, I think I can do it. So I dig through once again, continuation of step 2 itself. I identify competencies from general medicine and surgery. So at the end of step 2, I would have competencies from all phases put together into one big column. So here I have phase 1, anatomy, physiology, biochemistry; phase 2, pathology, pharmacology; phase 3, infectious medicine and surgery. Now, all of y'all might be asking this question: are we going to teach all this in the first year? No, it's quite impossible to teach all this in the first year. So we just want to pull elements from pathology or pharmacology, which would help reinforce what we are teaching. So I think about my linger. I want my case. How would I want my case to progress? I don't think I can teach pharmacology in this phase. It would be too difficult for them. And pharmacology goes hand in hand with infectious medicine. Maybe if I think about surgery, and I have quite a lot of relations to talk about. So surgery would be much more effective. I start planning my linker. So my linker is going to linger throughout the phases. So I plan my linker, and in the next part, I remove the competencies pertaining to pharmacology and infectious medicine. So now I have my all the competencies put together, which can be clearly linked using a case. Now, once I have done this, this is the end of step 2. I have put all my competencies together. For each of these phases, I would want you to review the competencies of all the subjects. If you look at the competencies, you can see that there will be common competencies. You can identify these competencies and reduce the redundancy. So here, if you look, what are the common competencies which you can identify? I see the liver functions, both in physiology and biochemistry. So I would want to do away with that. I would align it and sequence it in the next one part. So I would do away with those two competencies or put it in one subject and align the competencies and sequence it. So from the earlier phase, now I've put it such that I have anatomy, so that I talk about the structure of the thyroid gland. I go about my histology, microanatomy of the thyroid and the parathyroid is spoken about. So then it will be easier for physiology to speak about synthesis, secretion, transport, and the effects of iodine. Biochemistry will also talk about the functions of the thyroid gland and the thyroid function test. Pathology will give them a little bit of idea about how thyroid swellings are and a bit about microanatomy. And anatomy would come back about anatomically relevant clinical features of thyroid swellings, while our case would talk about the clinical applications of this thyroid, which is simply put, a post-thyroidectomy patient comes with hoarseness of voice, which is the nerve related. So this applied anatomy will be discussed. So now at the end of step 3, I have aligned my competencies and sequenced it. Now I go into the next phase where for each competency, I derive the learning objectives, learning sessions and assessment methods. And we go into forming learning sessions by putting together a bunch of objectives that can be accomplished together or require a similar method of instruction. Now, once you have the learning session, all these learning sessions put together from one phase is what we call as A2. So now we have put it up from anatomy, physiology, and biochemistry. Now I go on to review competencies from all the phases. So anatomy, physiology, and then in step 4, I go on reviewing the competencies one again. What can be shared from the same phase? What can be shared across the phases as a common thread for vertical integration, that is nesting, and then I choose a linker so as to put everything together. And this linker is usually a well planned out linker case, which will help go throughout the phases of learning. And in step 5, a lesson plan is created for the learning sessions that are all put together. And this addresses the topic from different subjects, forming an aligned integrated dialogue. So at the end of this, now you have a topic here. You go back, the topic committee will go back to the curricular committee or the phase-wise subcommittee first and identify a space in the calendar. So this space is going to be for A2. You have it there. And if you look at this space, you can see that it need not only be this aligned. You can have other non-aligned subjects being taught at the same time. Physiology, biochemistry, all non-aligned subjects can have a self-directed learning. But at the end of this session, you should have a formative assessment and quiz. So you can use different teaching learning methodologies as you progress through this. It can be lectures, it can be DOAP, it can be small group discussion or a flipped classroom. Case, you can use a hybrid model of learning where you give a case base and then you ask them to read and come. So all methodologies can be used. So at the end of this, you will have a base. Now, the summary of this session would be alignment and integration is an institutional policy governed by the principles of GMER. Why do you call it an institutional policy? Because it is the institution which will decide whether you want to do it as an organ-based or a system-based. How much do you want to do it? But they say that integration should not exceed 20% of the curriculum. And alignment can be done wherever possible. Up to 80% can be aligned. Space should be identified for non-aligned topics. The crux is assessment remains subject-based. So I believe I've given you a thin framework through which we will learn more about alignment and integration. Thank you for your patience here. If there are any doubts, please do put it down.
Thank you very much, ma'am. It was very lucid and very clear presentation. So I think there are not much question. Only there are two hand raised. So I would like to unmute Dr. Kanan. Please unmute yourself. Yeah, ma'am, please.
Yes, sir. Thank you, sir. Uh, Good evening, ma'am. It's really a very nice presentation, very clear presentation. The only thing I want to ask you that any guidelines about how much nesting we have to do. I just want to ask about the depth of the topic because many teachers are going into too much depth about the clinical aspects. So, is there any guidelines about how much nesting?
No, ma'am, there are no guidelines about how much nesting to do. MCI says that when we think it is appropriate for recall of information or to provide the connectedness, we can do nesting. So that's what, like we get over enthusiastic about nesting. Most of us, as
Yes.
anatomists and
Yeah.
as students also, we get over enthusiastic. So it's
And
up to
many
us
teachers
to define.
like.
Yeah,
Okay.
it's up to us to define as there are no clear guidelines on how much. The whole of integration should be only up to 20%. The rest is for alignment. Nesting, ma'am, I think for we expect an applied anatomy answer in every aspect which we ask them. So whatever becomes clinically relevant to them, that's all what we have to tell them. You don't have to go into too many details like how to do a coronary angiogram. No, you don't have to. We just have to tell them that a coronary angiogram helps you identify the vessels. Yeah.
Yes.
Thank you.
Okay. And one more, ma'am. Is there any guidelines for the arrangement of the linker session? Means any time frame for the arranging the linker session?
Ma'am, I didn't get your question clearly. Like any
Uh,
time frame
Means
means.
to arrange the linker session,
Yeah.
when to arrange? Is there any time frame?
No, ma'am. The alignment integrated topic team, which is simply called as the ATO team. The ATO team can go on to form the topic and then first coordinate with the phase-wise curriculum committee and find a space. So what we
No,
have
ma'am.
been doing in our institute.
Ma'am, I think
Yes,
she's
sir.
Kanan madam is asking that you have explained regarding the linker session. So
Yeah.
actually, when to have that linker session? That ma'am is trying to ask you, ma'am.
Yes.
Okay, sir. Yeah. So, ma'am, if you look at the slide, which can you see the slide, ma'am?
Yes. I am able to see.
Yeah, this red thing which you see here, that is your linker session, ma'am. We introduce the
Yes.
linker at the beginning of the session. And as they progress, they discuss about the linker in their small group discussions. And then at the end of the session, they will come to discuss about the aspects of the linker. So the linker actually runs through the phases. We introduce the linker in the beginning, it runs through the phase and reaches at the end of it. So at the end of the session, you should be able to give answers to the linker.
So it's like that the problem based learning we start with that, and then
Yes,
later
sir.
on
Ma'am, yeah.
okay.
Regularly what we do as a set induction for our class, ma'am, but the problem here should be well defined. So when you're designing, it's actually designing a linker. The designing of the linker is done by all members. So whichever phase you want to put it. So here you have anatomy, physiology, biochemistry, pathology, and surgery. They should all be sitting together and designing the linker. So in the first phase, we will think about the midline swelling, which moves with deglutition. Lab investigations will reveal a picture suggestive of hypothyroidism. Surgical session. So when they reach the second phase, you can use the same linker. Second phase, when they're learning pathology. So there they will speak about the histopathology of this case. When it comes to surgery, about the surgical complications. So you design a linker in such a way that you'll be able to use it throughout the course for the students.
So you are telling that the in linker session all the faculties should be there.
The planning of the linker session, all faculties should be there. For delivering the linker session, you don't need any faculty except the anatomy people. It's only for the planning phase that you need all the people there, ma'am.
Okay. Thank you so much, ma'am.
Thank you, ma'am. The questions were quite good. Thank you, ma'am.
We have one more, Dr. Vinaya. Can you unmute yourself? You are unmuted by us. Please unmute yourself, Dr. Vinaya. Dr. Anuradha, please unmute yourself. Dr. Anuradha Barua.
Yes. Good evening, ma'am. I have one doubt regarding, yes, ma'am, regarding nesting and sharing.
Yes.
What I have understood from your example, that when I teach anatomy and I have given something, I am relating with the radiology. That means it is a vertical integration. Can I say that nesting is a vertical integration with another subject, that is from different phase? From
yes,
the
nesting
example.
is when.
Yes, ma'am. Can I say that vertical integration between two subjects, nesting? And the sharing that you have given example, that biochemistry and physiology people, they are sharing. That means it is the horizontal integration between two subjects, that is two disciplines, that is the sharing. Am I right?
Ma'am, actually, ma'am, can I just explain that a little more? In nesting, ma'am, actually, you target the objective from a different subject. The different subject need not even know that you are targeting their objective.
Yes.
You don't have to plan it with them. While in sharing, so that is what is called as nesting. You can see this blue box. Can you see the screen, ma'am?
Yes, ma'am.
Ma'am, can you see the screen? Yeah. The blue box, if you think of it to be anatomy, and the gray box to be orthopedics. I'm taking a little bit of orthopedics and putting it into my session, which is my fracture of the clavicle. Or an anatomical snuff box, I'm talking about fracture scaphoid. Now, what happens is orthopedics people, when they teach about clavicle, they'll also be talking about the peculiarities of clavicle. So this phenomenon is called as nesting. There is no planning happening there. The teaching is basically subject-based and in silos. While if you look here, in this timetable, you can see that there are shared sessions. So what is shared session? So that is the part of it. You're teaching bilirubin metabolism and physiology. You want to go about and biochemistry also teaches about bilirubin metabolism. Both of them will sit together. They sit together and they say, one of us is going to be teach, only one of us is going to teach bilirubin metabolism. The other person can go on into the rest of the topics. So they don't repeat that part. There is a planning going on. And this planned session is what we call as sharing. The two
Yes.
disciplines will come together, they agree, and they implement the teaching program. You don't, they sit together. So that is what is called as sharing.
Okay, ma'am. Yes, I am clear. Thank you
Yeah,
very much, ma'am. Okay.
thank you. Any more questions?
Madam, there are a few hand raised, so I'm just trying to unmute them.
Yes, sir.
Dr. Asha? Yeah.
Yeah, ma'am, it was a very good presentation. I could understand many of the things. I would like to tell you, is the redundancy reduced due to sharing? Redundancy.
Yes, ma'am. Redundancy is reduced due to sharing. But one thing which we should keep in mind is, ma'am, we always say repetition will help them improve their knowledge. It will help them retain better. So that's one question
Yeah.
which we will have. So that's a question which rises into the mind of every teacher. So doesn't repetition
Yeah.
actually help? So
Uh,
when you start your class, you can actually say, they have told you this before, and that is we can recollect this during the first 5 minutes and then go on to our topic.
yeah, right.
So
Right. Okay.
so that's how we can actually allow for
Yeah.
them retaining more knowledge, ma'am.
Yeah, right. Yeah, this can be done in our same subject also, no, ma'am? Like
It can be done
previous
in the
session
same
is the
subject.
same session. Yeah.
Yes, ma'am.
Okay, ma'am.
Yes,
Thank you.
okay.
Dr. Prerna Agrawal, please unmute yourself.
Okay, good evening, ma'am. Ma'am, I
Good
just
evening.
want to ask you, when you were telling us about the sharing, in sharing, suppose you gave us an example, physiology and biochemistry department, both of them, suppose it's an example of liver. So, liver
Yeah,
physiology and jaundice and the metabolism of bilirubin, biochemistry is teaching us. So, sharing is when both the departments are teaching in the same session. Like what is the difference between sharing and temporal coordination? Temporal coordination, you said, time at the same time in physiology department they are teaching us about the physiology of liver, and in biochemistry they are telling us about the metabolism of bilirubin. And
yeah.
so I'm just confused about what is the difference between sharing and this temporal coordination, which means alignment.
Ma'am, can you hear me?
Yeah, ma'am.
Yeah, okay, ma'am. In temporal coordination, what happens is the two subjects don't sit together. They do not know what their objectives are. They just put it like, oh, okay, at this point of time, they're teaching liver. So now we will talk about half class and their objectives. While in sharing, what happens is some shared objectives are also taken up. Physiology doesn't talk about the whole of bilirubin metabolism. So if you put it in anatomical terms, we
I can't hear you. Hello.
Hello, ma'am.
Yeah.
I think there is some problem on ma'am side. We are not able to hear ma'am.
Yeah.
Dr. Angela, we are not able to hear you. Uh, I request one of the participants to please put in your WhatsApp group that you are not able to hear her.
Okay. Okay.
Yes. Mm. Can anybody put on her WhatsApp?
Hello, am I audible?
Yes, now you are audible, ma'am. Now you are
I
audible.
think I lost the connection in between. I'm very sorry. Very sorry. Ma'am,
Yeah.
yeah. Any more questions?
Yeah, actually, madam, we were not able. You were not able to complete the that sentence. You were explaining.
Okay.
So can you repeat it?
Okay, so sure. Because I really don't know when I lost my connection. So I was actually
Comparison
thinking,
between horizontal,
uh,
horizontal.
Sharing and temporal coordination.
sharing, yeah, yes, ma'am. Okay. So in temporal coordination, right, we don't have, there is only awareness of what is being taught. I know that biochemistry people are also teaching this, but I don't actually share any of my ideas with them. I teach liver the way I want to. They teach liver, the hepatobiliary, the bilirubin metabolism the way they want to. While if they're sharing, we sit together. I tell them, I'm teaching hepatobiliary tree. So I would like to take up a little bit of obstructive jaundice. Can I do it? I'll give the clinical features of obstructive jaundice. So then they say, okay, madam, you can teach obstructive jaundice. That is called as sharing. It goes a step beyond awareness, ma'am.
Okay, so that means the part which will be covered in physiology will not be taken up by the biochemistry.
No, in sharing,
And
it will not be taken up. Yes.
okay, and will they do that in the same session, like in the same class, or will they do it differently in their own lectures or in their own classes?
Ma'am, if you look here in this timetable, can you see the screen, ma'am?
Yes, I can see integration, correlation.
Ma'am, right now, I've put up a timetable there, ma'am.
No, it's not visible.
No, ma'am. We are not able to see your slide. It is only integration page we can see.
Now, sir,
No. Ma'am, you shut down your presentation and again open your presentation.
yes, sir, sure. Okay. So actually, if you look at this timetable, which I'll try to put up right now. So here, if you look
Madam,
at this timetable,
we are not yet able to see.
so can I
Have
talk
you
about it then? I'll talk
Yeah.
about it then. So, madam, so when a physiology class is going on, so we talk about anatomy and biochemistry, ma'am. And I am talking about anatomy class. It is within my anatomy class that I will be talking in the obstructive jaundice, that I'll be talking about the picture of obstructive jaundice. As I teach my common bile duct, its formation as it opens into the second part of the duodenum. So this is when I will be talking about obstructive jaundice. It is within the time frame. So here in this session, it will be a planned session where you don't need to take it to another person's time. You will deal with in your time itself.
Okay, okay. Thank you, ma'am. So that means temporal coordination, there is no discussion between the two departments, and they are going with similar topic at the same time, but without any discussion. And in sharing, they share what aspects of this same topic each of the department is going to take up.
Yes, ma'am, absolutely. The subject
Okay,
demarcations are removed in sharing.
okay. Thank you, ma'am. Thank you very much.
Thank you, ma'am.
I think, madam, there is no more question. So thank you very much for a lucid presentation. It is really, you have made the integration session very simple.
Thank you, sir.
And I think there is no more question. So we can end the session. And as usual, you will get the recording in the group. Okay. Thank you. Thank you very much, ma'am. And thank you all. Goodbye. Have a nice day.
Thank you so much.